Today's webinar is titled Men with PH, Specific Issues for Men Diagnosed with PH by Jeffrey T. Bonner. Jeffrey Bonner, he has been the program coordinator and lead physician assistant for the Brigham and Women's Hospital Pulmonary Vascular Program for almost 3 years. He currently cares for inpatients and outpatients with pulmonary hypertension. He has further interests outside of the clinical realm, working as a co-investigator for numerous studies at the Brigham and Women's Hospital, serving as his programs coordinator and thus the liaison to the PHA, assisting in forwarding the hopeful passage of the Massachusetts Pulmonary Hypertension Bill, and giving several pulmonary hypertension presentations in the last couple of years in an effort to educate patients and fellow clinicians and nurses regarding important aspects of this disease. He became interested in the topic of pulmonary hypertension in men when he learned of the interest in this topic by patient members of PHA, as well as his own male patients, ultimately leading to his participation on the panel discussion related to this topic at the 2016 PHA International Conference. Without further ado, please welcome Mr. Jeffrey T. Bonner.
Thank you so much for that introduction. In terms of learning objectives, it is my goal that the male audience today will better understand and know how to deal with all aspects of the diagnosis of pulmonary hypertension, including issues related to the disease itself, treatment issues, and psychosocial issues. Also of note, I have provided references on each slide, so you would be able to refer to them whenever you wish. First, I'd like to present these learning points through the experience of one of my patients whom I've known since he was first diagnosed. He's agreed to let me use his story to help you all better understand what a male patient goes through in the first year or two after being diagnosed. I will refer to him as EB. When I first met EB, he was engaged to be married. He was hoping to have children. He enjoyed working as a loan collector, played basketball with his friends quite a bit, but was hampered by his pulmonary hypertension. He just didn't know it at the time. And he has a lot of support from his family and his fiance's family, as well as he spends a lot of time with his friends. When I first came to know EB, he was 25 years old. He grew up with what he thought was asthma. His primary care had diagnosed him with that and had given him inhalers which were not helpful to him. And his lips would actually turn bluish when he'd participate in sports, but he tried his best to make sure that didn't deter him, and he did participate in sports. He was always known as kind of the slow or out-of-shape kid and didn't know why. His breathing became worse in his early 20s, so that he would become winded, even getting to the top of a flight of stairs. And I came to know him when he presented to our hospital after passing out playing football at a family picnic. So we quickly diagnosed EB with severe pulmonary hypertension. These are sort of the highlights here, that his heart catheterization showed that his pulmonary artery pressures were 4 times higher than the normal level. And although you can't read imaging, I have a picture here that shows he had a very big heart. It was very dilated and did not squeeze very well. So we had to be very aggressive with him because he was in a severe state of the condition. So we put in the Hickman line, which is that picture you see to the left. It's just a catheter that we infuse medicine through. And we started him on Remodulin, which is one of our most potent medications to treat pulmonary hypertension, with plans of him starting other medications in the future. This was the education point of meeting him. There was a lot of discussion with him about this medication, all the other possible medications he might be on, as well as what pulmonary hypertension was and what it meant to his life. He also was seen by specialty pharmacy nurses who did a lot of education specifically for Remodulin, which entails a lot in terms of using the pump and how to mix the medication and everything that it entails in terms of bringing extra batteries, and there's just a lot of things involved. And not surprisingly, he and his fiancée were quite overwhelmed with Remodulin and the diagnosis. Within a couple of days of him arriving to the hospital, he went from thinking he had asthma to wondering if he had anything else to all of a sudden finding out that he had a severe disease that needed basically for his life to change. All right. EB's initial concerns are likely your concerns. What does the diagnosis mean? How will it affect my life? How will it affect my job? How will it affect my relationship with my friends and family and significant other? Basically, how is it going to change my life and affect my future? To get a feel for what EB and many other men have to deal with when diagnosed with pulmonary hypertension, this is a good slide showing how the physical, cognitive, and psychosocial aspects of this disease can affect every aspect of a man's life. In the study referenced at the bottom of the slide, 56% of all patients with pulmonary hypertension reported that the disease did in fact affect their life in a significant way, with the areas most effective being work, travel, household chores, social opportunities, and relationships. As symptoms worsen, this percentage rises. In the same way, significant others reported this affecting their lives significantly as well, 57% of the time, with 43% of significant others reporting feeling exhausted related to the extra duties and stresses of caring for someone with pulmonary hypertension. When a man starts to feel limited and less independent, his confidence and self-image are affected adversely, leading to personal and social issues that can create a downward spiral if not addressed. I will be discussing how to address these issues today. One other stressor that I'd like to mention is employment and finances. 85% of pulmonary hypertension patients report that their employment was affected by this diagnosis. Compounding this is that 29% of significant others caring for PH patients also had their employment affected. And not surprisingly, this reduction in the ability to work resulted in consequences on overall household income, with 73% of patients and 35% of caregivers reporting an impact on their finances, often leaving many of these families with below average incomes. All right. Since EB's discharge a year and a half ago, he has had a rocky road with ups and downs. On the negative side, his symptoms and medication side effects have limited his ability to live his life the way he wants to live it, and also has greatly slowed his ability to increase his Remodulin dose to a level that would actually be helpful to his symptoms. He also developed an allergy to the bandage that holds his Hickman catheter in place. He's coughed up blood twice related to increased nosebleeds, which goes along with one of his new medications as a side effect. His Hickman catheter disconnected from his Remodulin pump line at one point while he was laying on a beach in Aruba, and it ended up back bleeding onto his chest, and obviously was stressful. He was able to deal with that himself, but it did result in a frantic call to our office from Aruba. But eventually he actually snagged the Hickman catheter on a doorknob and pulled out the catheter and had to go to the emergency room to have it replaced urgently. But on the positive side, he did get married, and he actually is now on good doses of all of his medications. He's on Remodulin and 2 other medications. And now his symptoms are almost non-existent. He's able to do what he wants to do with some very minor limitations. And he does still have some mild intermittent medication side effects, but for the most part, those are able to be dealt with other medications, like pain medications and the like. All right, so what are the physical limitations of pulmonary hypertension that progressively affect a man's life? Early symptoms are often generalized, like feeling more fatigued or winded with activities that had not been difficult in the past. However, as pulmonary hypertension progresses, the heart will weaken, leading to fluid accumulation in the body, which is manifested by swelling in the ankles or in the abdominal area, and even can flood the kidneys to some degree and cause kidney function to worsen a little bit. As the heart weakens further, there's eventually a decrease in the ability of the heart to pump well, and patients often feel lightheaded or dizzy or have chest pain and shortness of breath, and maybe even a rapid heart rate with exertion, and that may progress so that even mild exertion produces those symptoms. All of these symptoms of pulmonary hypertension will limit a man's life to some degree. Medications are important and will help you to feel better, but they often come at the cost of side effects, especially with pulmonary hypertension. These side effects are often mild and can be minimized or eliminated with other medications to treat headaches and nausea and the like. There are also 17 FDA-approved medications for pulmonary hypertension at this time. And I only mentioned this so that you would know if you did encounter bad side effects, you wouldn't feel like that was your only option. We can easily switch to other medications that should be just as effective. All right, these are the medication classes that target the disease. Most of them cause annoying side effects like headache, flushing, nausea, diarrhea, as well as body aches and pains. These are kind of true across all these different classes. These are usually tolerable and treatable, but sometimes the side effects can be severe. Even in these cases, the side effects often subside in a matter of days to weeks, but not always. So that's where we come to the point where we could switch to another medication if need be. Severe headache or dizziness can be debilitating and make it so that a man can't function. And gastrointestinal side effects like nausea and diarrhea can keep you from being able to even leave your home if they're severe enough. Specific to men is priapism, which happens in the phosphodiesterase inhibitor class. These are medications like sildenafil and tadalafil, which may be known to you as Viagra and Cialis, which at different doses is used for erectile dysfunction. Priapism is an erection that is an emergency and can cause damage to the penis if the erection lasts for longer than 4 hours. However, you should know that at the doses which are used for pulmonary hypertension, which are lower doses than that used for erectile dysfunction, it has never been reported for any pulmonary hypertension patients to get a priapism. The endothelin receptor antagonist class can reduce sperm counts and motility, making conception of a child more difficult. EB, our case study today, actually banked his sperm to be used later for IVF or in vitro fertilization after he started one of these medications. Mutagenesis, you see there in red, just means birth defects. This really more affects women, but I just wanted to point that out. It doesn't affect the sperm in a way that would cause birth defects, but it can affect women. Once a man starts to feel noticeably limited by the disease symptoms and medication side effects, his self-image is also affected. Self-image is defined as the way a man feels about himself, about his abilities, and his appearance. Here's one magazine's idea of the perfect man. No man can live up to this fictional perfect man stereotype that society and media propagate. Along the same lines, this is what is pushed in the face of every man out in society, in lines at the supermarket and the drugstores. Again, a fictional portrayal of a perfect man with a perfect life, designed to make men feel bad about themselves and want to buy the magazine to learn how to be more perfect. But all men, including the men in these magazines, have problems in their life, and nobody's perfect. So men should not root their vision of themselves in what media or others say they should be. Pulmonary hypertension affects every aspect of a man's life, including body image. The eventual limitations caused by this disease can result in a loss of a man's identity if they can no longer do the things that once defined them, things like their job, hobbies, social interactions. Maybe they used to play racquetball and now they can't do that. This can lead a man to reevaluate his new life of pulmonary hypertension and devalue his self-worth, ultimately causing depression and isolation if not addressed. Even in an early stage of this disease, when a man does not feel very limited, knowing that pulmonary hypertension is a progressive disease with no cure can lead him down this path of despair as well. This slide shows just how much men diagnosed with this disease are affected emotionally. 35% feel frustrated, while a quarter feel misunderstood, worthless, have low self-esteem and low confidence, and just don't enjoy life as much as they once did. Over half report feeling socially isolated due to a lack of understanding of their disease by their friends, family, and coworkers. Relationships can be affected in many ways as well. Most of the time, friends and family won't understand what you're going through. There will be a wide range of reactions to your diagnosis, some positive and some negative. They might try to help you more than you really need. You might feel like they're babying you when you don't need that. They may pull away just because they're not sure how to act around you anymore now that you have this diagnosis. And in some cases, some of my patients have reported frustration because those that they know, especially in the work setting, feel like this isn't real. They don't look sick, so they're wondering if they're just exaggerating what's going on. So again, this can be frustrating for men with pulmonary hypertension. All right, this slide helps us to appreciate the effect this disease can have on our loved ones, because relationships are a two-way street. So both of you are having to deal with this major life change. 2/3 of caregivers feel anxious about the future, and 1 in 5 feel stressed about their new responsibilities. 20% of caregivers feel trapped into the new life that they have, and 1/3 feel socially isolated due to having to spend a great deal of time with their loved one and in helping them. On average, a caregiver spends about the same time caring for their loved one, this is on average, as they do caring for themselves. Caregivers are also concerned that they won't be helping you correctly. They won't be doing you justice when they're trying to help you, and they're anxious about that. But on the flip side, 92% of caregivers report feeling that they have contributed positively to their loved one's quality of life, while 2/3 report caring for their loved ones has actually brought them closer. So this is a good segue to our next topic, which is intimacy. As just mentioned, a man and his partner's response to this diagnosis can greatly affect his intimacy with his partner. All right. 3/4 of couples where one person has pulmonary hypertension report that their sex lives were severely diminished. This rises to 93% of couples when the pulmonary hypertension is severe, with 2/3 of those with pulmonary hypertension that is severe stating that they have no desire at all for sex. 1/4 feel less close with their spouse because of this, and 1 in 5 spouses feel that their relationship has changed from that of being viewed as a lover to one exclusively as being viewed as just a caregiver. So why is this? Well, 1/4 of pulmonary hypertension patients report that their physical limitations result in embarrassment and a lack of enjoyment of sex, and this leads to a lack of interest in pursuing sex, which is manifested by avoidance of even showing affection and pursuing sexual intimacy, which is not a good thing for relationships in general. 3/4 of both members of a couple wrongly feel that the exertional level of sex will worsen the patient's condition, shorten their life, and put their life at risk while participating in sex. But this isn't true, and I'll talk about this a little bit later in the presentation. Medications can have side effects that negatively affect sexual desire and arousal, as well as the ability to have an orgasm. You can see the list of medications over here on the right-hand side, and I've just put red boxes around the ones that are most commonly used in patients with pulmonary hypertension. Other treatments like oxygen and infusion pumps with the tubing that comes with those can get in the way and create an obstacle toward interest in having sex, basically thinking it's not worth it, it's too much trouble to even try, but there are ways around this. And then finally, having a negative self-esteem, as we talked about a minute ago with body image and the effect of pulmonary hypertension on one's psyche. But having negative self-esteem, body image, depression, anxiety, grief, and stress can also affect negatively a man's desire and arousal for sex. Just like it says here, is there any hope for leading a normal life? With quotes around normal, obviously your life will be affected by pulmonary hypertension, but can this be limited to a minimal amount? Well, the answer is yes. There is hope of living a close to normal life. Many men diagnosed with pulmonary hypertension have used the techniques listed here to live positive and fruitful lives. The first step, and probably the hardest, is accepting your diagnosis. Just as it takes grieving to help deal with the loss of a loved one, it also takes grieving to deal with the loss of the person you might have been if you hadn't been diagnosed with pulmonary hypertension. You must then accept that you have pulmonary hypertension, that there was nothing you could have done to prevent it, and that there was nothing you did to deserve it, and that there's no way you can change having this diagnosis. This was just random, albeit a very unlucky event in your life, but now you have to address it. Constantly worrying about your disease will do nothing to help you, but learning how to live with pulmonary hypertension should now become your primary goal. I like quotes, and really like the one here by Michael J. Fox, which pertains to men dealing with pulmonary hypertension. Acceptance doesn't mean resignation, It means understanding that something is what it is, and there's got to be a way through it. He's stating that acceptance is not just resigning or giving in to Parkinson's disease like Michael J. Fox has, or pulmonary hypertension, or any chronic disease, but also accepting the challenge and being determined to find ways to live well with the disease. I also like this other quote in black. It says, if you don't leave your past in the past, it will destroy your future. Live for what today has to offer, not for what yesterday has taken away. I don't know who originally said this, but this is the inspirational quote on EB's Facebook page, and I believe that it says it all when it comes to accepting your diagnosis. Quotes like this can be used, as mantras to help keep you focused on accepting and moving forward with pulmonary hypertension. All right, supportive relationships are critical to winning pulmonary hypertension battles. Men often want to deal with coping with just about anything on their own, but seeking help from family, friends, professionals, and even pets is critically important. We all falter when it comes to cherishing our relationships with family and friends, but a man with pulmonary hypertension should treat these relationships like gold, because these relationships are what will sustain him through the hard times and keep him motivated to fight his disease and work hard to keep a positive outlook on life. You can see here in green the benefits of social support with chronic diseases. They include living a longer life, doing what the doctor tells them to do more often, which will help them to ultimately feel better and likely live a longer life as well. They help them to increase their ability to cope with stressors in life, which will help their immune system and lower the number of times they get infections or get sick. It increases their sense of well-being and also decreases the incidence of depression and isolation. As mentioned earlier, family and friends will respond to your diagnosis in different ways, some positive and some negative. Open and honest communication will help both parties in the relationship adapt to this life change. So be honest with yourself about your limits and make sure that your caregiver knows your limits as well. There will be an adjustment period in your relationships. The first year is usually the hardest, but knowing that will help you to deal with it. Allow yourself and others to adjust to your new situation in their own time. So give them space and let them know when you need space. Mistakes will be made during this adjustment process, so be forgiving of others and yourself as you move through this transition period. Holding on to anger and resentment over these mistakes will only derail your progress. Be realistic. Know that there will be ups and downs, and be ready to weather those storms. Do as much as you can to help yourself and your caregiver. This doesn't only mean, doing chores around the house, but also taking your medications, keeping doctor's appointments, eating right, exercising, getting enough rest. All these will ensure that you're in the best possible health and the best possible mood, which will help you to remain in good spirits and have a more positive life. Helping yourself and others will also help your self-esteem. You should make the time to spend quality time with family and friends. You may, be really busy and not feel that you have that time, but those relationships are what will sustain you, so it's important to spend time with those that are important to you. Let them go just means after your diagnosis, if you feel like some relationships are going in a negative direction despite your best effort, don't give up on it right away, but if it seems like it's not going to change, you may have to sever those ties, as negative relationships will only hurt your ability to remain positive in your fight against pulmonary hypertension. Finally, be open-minded to forming new friendships and new relationships with a focus on supportive people that maybe you didn't consider being friends with before. But these people will, again, help you to better fight your battle. Physical intimacy is important to physical and mental well-being of men with pulmonary hypertension, as well as an important part of maintaining a strong and positive relationship with your partner. Few chronic illnesses require abstinence from sexual activity, but may require some adjustments to better tolerate the exertional requirements of sex. The general rule followed by physicians is to tell their patients to listen to their body and only exert themselves to the point that does not cause symptoms. If the symptoms happen, it is not harming your body, but you should take a break and let the symptoms subside before resuming sex at a less vigorous level. Only those men with the most severe symptoms should abstain from sex until their symptoms improve with treatment adjustments and being cleared by the doctor, of course. Some of these simple adjustments that can pay big dividends are staying as healthy as possible with a good diet and exercise program that you're capable of. Planning is also important. Avoiding sex when medication side effects are bothersome. Planning for sex at times of the day when you have the most energy, and securing oxygen and infusion pumps prior to sex will lead to better experiences that will bolster your confidence in your relationship. Having open communication and a willingness to try new things, such as less exertional sexual positions, can open opportunities to positive experiences as well. All right, the implantable pump. So this is exciting from our standpoint and also for our patients. This is something that's on the horizon and should hopefully be here this year, hopefully sooner than later. This is a pump this is for patients who are on IV medication, specifically on Remodulin. But if you're on other things like Flolan, you can be switched to Remodulin, and then that dose would be used for this pump. But basically, it's a pump that goes underneath the skin and needs to be refilled about every 2 to 3 months. But other than that, there's no worries about it. The pump does all the work. And the patients that we have in research studies have told us that this pump is something that gave them their life back. There's no more dealing with the external pump. There's no more worrying about infections, no more spending hours mixing medications and carrying around bags and extra pumps and batteries and extra medication and planning for trips, to bring everything. You can do what you want to do. So this gives men a lot of independence. It bolsters self-image and confidence, and positively improves a man's ability to be comfortable with intimacy. So if you fall into a class where you're on an IV medication for your pulmonary hypertension, it's worth asking your doctor if this pump is right for you. Related to intimacy is the concern about having children and passing on the disease. This is a real concern, and 2 forms of protection should be used when having sex. Based on the REVEAL registry findings, the main mutation related to pulmonary hypertension is passed on to offspring 25 to 75% of the time, depending on the type of pulmonary hypertension the man has. Furthermore, the disease is likely to be more severe in subsequent generations. However, there are options. Of course, adoption is one of them. but for those that really want to have a child through natural childbirth, I recently learned something exciting from my case presentation patient, EB. He actually sought out genetic counseling. We sent him to that. It was done at the Children's Hospital in Boston, which is just right across the street from us. He and his parents had genetic testing, and he was found to actually have the most common gene called BMPR2. He had a mutation in that gene, although his parents did not. So he fell more into that 25% class, but there was a risk of passing on this disease. But he was also connected with some genetics physicians here at the Brigham and Women that worked collaboratively with the Children's Hospital, and they've accepted him for genetic engineering. So basically what they're going to do is the sperm that he banked prior to starting the endothelin receptor antagonist, which makes it less likely to conceive a child. He has that already for in vitro fertilization, and these genetic physicians are actually going to substitute a normal gene for the mutated BMPR2 gene. So effectively, they're going to take out the gene that is most likely the cause of his condition, and there will be no chance of passing it on to his children. They will implant the new sperm into his wife's egg, and will create a young life that won't have pulmonary hypertension. So very exciting. All right, communication is the key to your relationship success and your prospect of success in living a positive life with pulmonary hypertension. If you can be open and honest with others, think before you speak, and truly respect those that you love, even if they are having trouble showing it or coping with your diagnosis themselves, then you will set yourself up for an enjoyable life. There are some common pitfalls that people struggling with stressors in a relationship fall into. These pitfalls will only lead to tension, arguments, avoidance, and ultimately an end to the relationship if not addressed. Therefore, you should practice the strategies on this slide and make them habits in order to develop effective and respectful conversation with your relationships. You should avoid saying you at the beginning of your statements, as it sounds like you're judging them negatively or you're ordering them to do something, and nobody likes that. So things like you should, or you need to, or you are not accepted very well on the other end of the conversation. Avoid words like always and never, which generalize a person's character in a negative way. You never listen to me, you always avoid me. These sorts of things will just turn off the conversation and lead to an avoidance of conversation. Avoid combining the person with the issue. So I kind of like this one. You never clean up, you're such a slob. That is very ineffective, and it's not going to incite change. It's not going to get that person to do the job that they had agreed to do, which is clean up or clean dishes. But if you just take it and don't get frustrated and use more of a tone of, hey, I noticed that you forgot to clean the dishes. Would you mind please doing that now? That's more likely to lead the person not to be frustrated by you, and also for them to actually do what you're requesting. Avoid invalidating your partner's points. If you tell them that they're exaggerating or that they don't know what they're talking about, it's very unlikely that future conversations are going to be open and honest and helpful. So seek other forms of support. No matter how much others might care about you, they will never fully understand what you are going through as a man with pulmonary hypertension. Therapists, support groups, and mentors can be an integral part of adapting your life to pulmonary hypertension. 13% of men are depressed, 20% of chronically ill men are depressed, and 30% of hospitalized chronically ill men are depressed. So you can see this trend that the more severe the chronic illness, the more likely you'll be to suffer from depression. Preventing or treating depression is very important, as depressed patients are less motivated to care for themselves. If they don't actively pursue treating the depression, then it can have them delay taking care of themselves, which will make their symptoms worse and lead to a downward spiral, resulting in worse overall prognosis. All right, this is the PHA Friends link on the PHA website, and it offers several opportunities for requesting and also offering support to others. Specifically, this is the mentor page, and it allows you to connect with other men with pulmonary hypertension and ask them questions and learn what they did to help them to deal with similar issues. Also, if there are issues you're having trouble finding an answer to, you can always submit your request to the Men Living with PH Advisory Board webpage, and the board will work to ensure that your questions and issues are addressed through the website or at upcoming conferences, or even through webinars like this one. Finally, if you can make it a habit to be as positive as often as possible, research shows that you will never live, that it shows that you will live a happier, healthier, and longer life. Let's see, I think the slide advanced here. There we go. You should take care of yourself, eating right, getting enough sleep, and staying active. These will not only treat your disease, they will also help you to feel better and improve your mood and outlook. EB changed his diet and lost several pounds, which helped him to feel better. You should be proud and celebrate your accomplishments. Tell others and keep a journal of your milestones. EB does this in a more electronic way. He has an active Facebook page and has many references to the milestones that he's reached in his progress with living with pulmonary hypertension. Lastly, people who volunteer tend to have higher self-esteem, psychological well-being, and happiness. So once you've adjusted to living with pulmonary hypertension, consider being a mentor through the PHA Friends program. EB's way of doing this was to organize and work with his family to raise awareness and funding for pulmonary hypertension. This is actually a picture of EB at the Massachusetts State House in front of representatives in support of a bill to raise awareness and research funding for pulmonary hypertension. And I am happy to report that as of this past Friday, that bill was passed and signed into law by the governor, which makes it the first law of its kind in the country. There is a similar law on Capitol Hill, national or federal law, but that one's had more trouble getting through. So hopefully his efforts will push things at the national level and help all men and women with pulmonary hypertension. You can also see that his family organized this Boston Breathe Walk, which raised over $90,000. Actually, this $92,000 is an old number, and it's last time I checked, it was up to $95,000. So that has really helped him to move forward in his life, and doing things like volunteering and helping others can help all men to better deal with their disease and move forward in life.